Hi everyone! Today, I'm going to demonstrate the adult and infant CPR. But before that, what is CPR and its importance? Cardiopulmonary resuscitation is an emergency procedure that can help save a person's life if their breathing or heart stops. When a person's heart stops beating, they are in cardiac arrest. During cardiac arrest, the heart cannot pump blood to the rest of the body, including the brain and lungs. That can happen in minutes without treatment. CPR uses chest compressions to mimic how the heart pumps. These compressions help keep blood flowing throughout the body. We can use Dr. ABC to this: danger, response, airway, breathing, and circulation. So now, I'm going to demonstrate the adult and infant CPR. Danger. Before approaching the casualty, always make sure the area is safe. Response. Check if the casualty is responsive or unresponsive. As you approach them, introduce yourself and ask them questions to see if you can get a response. Kneel next to their chest and gently shake their shoulders, asking, "What was happened? Open your eyes." If the casualty opens their eyes or gives another gestures, they are responsive. If they do not respond to you in any way, they are unresponsive and should be treated as quickly as possible. Airway. Next, you need to check that the airway is open and clear. Open the airway by placing one hand to the forehead to tilt the head back and use the fingers from the other hand to lift the chin. If they are unresponsive, you need to move on to breathing as quickly as possible. Breathing. You now need to check if the casualty is breathing normally. Place your ear above their mouth, looking down their body. Listen for sounds or breathing and see if you can feel their breath on cheek. Watch to see if their chest moves. Do this for 10 seconds. If they are responsive in breathing, move on to the circulation. Circulation. Once you have established they are breathing, look and check for any signs of severe bleeding. If they are bleeding severely, you will need to control and treat the bleeding by applying direct pressure to the wound and call for emergency. If they are unresponsive in breathing, but with no bleeding, put them in the recovery position and call for emergency help.
Hello? Can you hear me?
And now, we're done in adult CPR. Let's move on to infant CPR. CPR is one of those things that everyone should know how to do, even if everyone hopes they'll never have to use it. This is especially for true parents and other caregivers, since knowing CPR could save your child or infant's life. Unfortunately, adult CPR certification doesn't automatically qualify you to perform CPR on children or infants, as the procedures are different. So now, let's CPR an infant. Step 1. Check for responsiveness. Gently tap the infant's foot or shoulder and yell. If the baby is unresponsive, move on to the next step and call the emergency immediately. Step 2. Give 30 chest compressions. Put the baby on a hard, flat surface. Take 2 fingers and find the center of the chest just below the imaginary line between the nipples. Push down 1/3 the thickness of the chest at a rate of 100 per minute. Step 3. Open the airway. Gently tilt the head back, being careful to not tilt it too far. Step 4. Give 2 breaths. Cover the mouth and the nose with your mouth, creating a seal, and give 2 gentle breaths, watching to see the chest rise and then release. Step is continue giving infant CPR until help arrives. CPR keeps blood flowing to the brain and other vital organs until advanced medical help can take over. Thank you for watching.